So my name's Sam Bray. I am the Human Factors Programme Fellow here now at the Trent Sim Centre, but my background is as an operating department practitioner here at NUH. So I came on board about 2 years ago with the first project that I'm going to talk about, which is NUH Teams. So the NUH Teams programme is a team training programme, but it's a little bit more than just sitting people down in a room for half a day and looking at some of the key concepts around teamwork. And what we've realised is that teamwork does play a big part in some of the incidences that we've had, whether it's a failure or miscommunication, and actually there is a big need for us to actually be looking at improving how our teams work together. How have we done it? So we've been looking at doing some bespoke training with the teams. So we know that sitting them down for a half a day session does increase their knowledge. It might change their behaviours, but what we know what really does make a difference is actually getting part of their team to actually have a better look at what's happening in their environment. So the programme comes with some tools and some strategies that we can help the team try to embed into their day-to-day work. And we give them lots of data and ongoing coaching support to actually help them achieve some of the things they want to address. So what we've been doing is, the biggest kind of outcome that we've got from the programme so far is that it's the teams being able to have that greater knowledge about the system that they work in on a day-to-day basis and the processes that they have to work within to try and achieve some of the work that they're doing. And I think one of the most interesting things for us to learn was that quite a lot of our teams don't know their outcomes of what their work is. So they only get to see a small proportion of what actually happens, or a small proportion of the bigger picture. So being able to give teams this bigger picture of understanding actually how they behave together as a team and how they work together actually has a huge effect on the processes and the patient's outcomes. And the biggest thing for us is actually giving the teams almost permission, if you like, to have the ability to influence their world. So we're actually going back to the people, these are the experts in their field, and saying to them, what's wrong, what's not working for you, and how can we look at it to make it better? So some of the longer kind of outcomes that we're hoping to achieve with the programme, we're already starting to see some of this with some of the teams. So one of the teams that we've worked in particular wasn't in a very good place. They had a lot of input from ourselves and lots of other organisations coming in and trying to help them. They had a really poor retention, so the team was actually heavily based on using agency. They couldn't retain staff. What we're seeing now is a waiting list to get into this team now. So the whole ethos around the team, their team working, their morale has changed so much that actually people want to work in this team. We've got students begging to go and work in this team. We've seen a reduce in their incident reporting, particularly around certain aspects that they've worked on, so around tissue viability and equipment issues. So some of that data is actually coming out for us now, and we can start to see some of the benefits of actually implementing and working with teams on a bit more of a bigger scale. So the second project I'm just going to talk about is ScanSafe, or some of you might be a bit more familiar with the national name of the project, which is ScanSafety. So in a nutshell, what we're looking at trying to do is scan items. So we're looking at doing this in theatres at the moment. So let's say you're coming down to have your hip replaced. Little bit like what Sue was talking about, some of the complexities of how the staff have to pick the right implant. So what we're looking at here is just being able to scan items so we can track them, because at the moment it's not very clear. Once items come into the trust, they kind of go into a storeroom somewhere, they get used, and then we probably never hear or see them again. So what the ScanSafety project really is looking at is trying to have some traceability on these products. So we will know where that product is in the system. We'll know it's sat on this shelf in this room, and then when it gets used on a patient, we know it's got used on this patient on this day, And then if there is anything that happens and that product has to be recalled, we can easily retrieve that information. So what have we been doing as part of that? So we've been going in and helping the team actually look at, well, how do we actually do this? Because what we're trying to do is put in a new system. This isn't something that we already do. We don't scan items. So how do we actually do it? And who does it? And when does it happen? And what are the consequences of a certain professional group doing that at a certain time? And what are the actual items that we're using? So what does the scanner look like? Is it easy to hold? Actually, what's the interface look like? What's the software like? So it's a huge project at the moment, and what seemed like quite a simple project to actually implement has now become quite a interesting and quite challenging project, because we want to get it right the first time round. And what we've realised is that without having the human factors element into this could have quite easily have got a lot further down the road, and we'd have been seeing some bigger consequences from implementing it. But being able to actually have the support and actually the trust from the actual organisation to say, actually, we think it's really important that you have a look at this. So we actually embed in the right way of doing this for our staff. We're actually managing to sort of influence this. So what we're hoping to do is make sure that actually it's suitable for the user needs, so it does what we want it to do, and actually it's going to reduce errors and not make the system more difficult, so that actually our staff are doing workarounds because it doesn't do what we want it to do, and they'll just fudge a little bit here and do a little bit different here to get it to work. So the whole idea is that we make something that is bespoke for them, that works. And then obviously being able to have a really good system for patient safety to track back on our stock and our implants, massive benefit for our patients, and also the financial people in the room, if there is anybody, really good financial savings on being able to look at our stock inventory. So just basically being able to reduce what stock we have on our shelves, because we're managing it a lot better. And they're my projects. Thank you.